down. Good morning, fellow Namibians. Allow me to begin by wishing you once again, all Namibians in all 14 regions, a healthy, productive, prosperous New Year, 2022, the year of re-imaging. Every new year presents a fresh start, a new beginning, a new work style, not only harder but smarter, guided by lessons from the previous year. To refocus our vision in order to achieve the goals we have set ourselves for as a nation. In light of what we have been through over the past 2 years, this is our opportunity to form a new and optimistic mental picture for the future we hope to embrace. This moment presents yet another chance to pursue our dreams with a renewed vigor and focus to achieve success against all odds. I'm confident that this year of re-imaging, we can become a better version of ourselves and our country. Following a very deadly third wave of COVID-19 mid-last year, we are all ever more grateful for good health and the invaluable gift of life. Many of our compatriots did not make it to this day. We will continue to cherish them in our memories. But we must forge ahead relentlessly in 2022 to make the Namibian House a truly inclusive and prosperous home for all its citizens. The fourth wave, which was spurred by the outbreak of the Omicron variant of COVID-19 in Namibia in November 2021, was characterized by a very high transmission rate with moderate hospitalizations. We must therefore proceed with caution because the invisible enemy remains in our midst. We will not be safe as a nation and as the global community until all citizens are safe. Combating this virus is a huge undertaking that will require every human effort, diligence, and compliance to overcome it. As we embark upon a very new year, we also need a critical re-evaluation of our hearts, minds, and actions to rid ourselves of behavior that may be undermining our efforts of defeating COVID-19. Let us continue to maintain a regimented personal discipline of social and physical distancing, hand hygiene, and wearing of face masks in public areas, in line with the health protocols. Let us also desist from spreading harmful and unscientific disinformation, which undermines the government's efforts to protect lives and livelihoods of our people. Notably, vaccine hesitancy persists, and as of 11th January 2022, the coverage of fully vaccinated populations remain low, in particularly following areas. And I'm going to mention them. Starting with the 5 regions. Zambezi at 6% only, Ohangwena, Omusati, and Ochikoto at 9%, and Oshana at 10%. The regions with the highest fully vaccinated population coverage are Hatap at 23%, Kavango West and Omaheke at 19%, and Gunene and Klaras regions at 18% each. The capital region, Khomas region, records a fully vaccinated population coverage of only 17%. The COVID-19 vaccine is an effective measure to mitigate severe illness and death from infection, and I therefore urge all eligible members of the public to go and get vaccinated and get your booster shots as means of bolstering your immunities. This is a personal medical decision that should be considered in a greater interest of protecting the collective. Vaccination is our best chance to kickstarting our economy. The hour is now for us to rebuild our economy and our communities that have been devastated by COVID-19. Without doubt, it will be a long road ahead. However, with the resilience and ingenuity we have demonstrated over the past 2 years, I am confident that by holding hands and by standing together as one Namibia, one nation, we have it within us to re-image our country for better and in the interest of our current and future generations. Fellow Namibians, the current regulations are due to expire at midnight on 15th January 2022. And I will allow now the Minister of Health to elaborate on new measures, which are very, very few, for the period of 16th January to 16th February 2022. I left out all technical points. There are none. But the Minister, as a technical person, can now tell us about the status of our health situation. Comrade Minister.
Thank you very much, Comrade President, Vice President, DPM, Ministers, and everybody, fellow Namibians. First of all, allow me to extend my festive greetings to Your Excellency and to all fellow Namibians. It is our hope that the new year will deliver us from the worst form of COVID-19 and that the country will embark on the road to recovery and prosperity. Last year was the second year we spent consecutive festive season amidst a wave of COVID-19. The fourth wave, which is driven by Omicron variant, was detected towards the end of November 2021. This variant proved to be highly transmissible, albeit not as severe and virulent as the Delta variant, which we controlled successfully after it caused devastations on health, economy, and livelihoods. We are currently observing a significant number of people getting infected and hospitalized. Some of them have succumbed to the disease. As at 11th January, that is yesterday, 2022, Namibia has recorded a total of 153,290 new COVID-19 cases out of 893,635 samples tested. This translates into an additional 19,846 new confirmed cases since the last briefing, which took place on the 14th of December 2021. We have noted with a concern an increased number of people who were infected previously getting infected again. We have recorded a total number of 1,876 reinfections since the 8th of December 2021. A total number of 140,973 recoveries were reported, translating into a recovery rate of 92%. This is a reduction of 2.7% from where we were during the last briefing, owing to increased number of cases reported during the fourth wave. Active cases have also increased threefold to 10,418 compared to 3,392 active cases we had during the last briefing. More 183 lives were lost, bringing the total number of deaths to 3,761 since the beginning of the pandemic. The fourth wave started on the 29th of November 2021. The cases peaked on the 19th of December 2021, when we recorded a total of 1,334 new cases within 24 hours. The cases have since started to decline from the 26th of December 2021, with a current average of 450 cases per day. From the 16th of December to the 11th of January 2022, a period of 27 days covering the current dispensation, a total of 68,975 samples were tested, of which 18,586 new cases were confirmed, giving a positivity ratio of 27% compared to 11% positivity ratio during the preceding period. These figures indicates that the number of tests conducted increased by 37.2%, and the number of new cases increased by 69.8%, while the positivity ratio increased by 59.3%. Correspondingly, the number of deaths increased exponentially from 13 deaths reported during the preceding 27 days to 181 deaths reported during the period of 27 days during this dispensation, which is an increment of 92.8%. The number of inpatients increased to an average of 362 per day compared to 198 reported during the preceding 27 days. Vaccinations remain one of the most effective preventive interventions we continue to promote. Vaccines helps the body to fight the infection and prevent severe diseases, thereby reducing hospitalization and deaths. There are few vaccinated individuals who may get severe illnesses and succumb as a result, mainly due to existing medical conditions or comorbidities. It is for this reason that as a scientific community, we encourage individuals, especially the vulnerable ones due to comorbidities, to get the booster doses. As at 11 December 2021, a total of 411,163 persons have received the first dose of COVID-19 vaccine nationally. This translates into a 22.7% of the target population. Of these, 408,658 are persons aged 18 years and above, representing 27%, and 2,478 are children aged 12 to 17 years, representing 0.8% of that target population. Collectively, 348,552 eligible persons are fully vaccinated, inclusive of 410 children aged 12 to 17 years. We are content that the daily vaccination uptake increased by 52.7% from 2,112 on the 13th of December 2021 to 4,466 on 11th January 2022. Following the introduction of the booster doses, 8,290 people have received their booster doses thus far. We encourage more people to enhance their protection by going for their booster vaccinations. We are observing many instances of reinfection and breakthrough infections among the population. During the last briefing, I explained in detail the mechanism of reinfection and breakthrough infections, such that I do not need to repeat that today. These phenomena are expected to happen. Nonetheless, the occurrence of reinfection and breakthrough infection should not discourage us to get vaccinated. We should continue to adhere to all preventive measures in order to protect ourselves, our families, friends, colleagues, and anyone else we may come in contact with, even after full vaccination and after full recovery from COVID-19. We have noted with disgust the persistent and sustained anti-vaccination campaigns laced with false narratives that people who are dying from COVID-19 are those who are vaccinated. Whereas the anti-vaccination proponents decampaign vaccination, they have no viable alternative to offer in relation to vaccinations. On analysis of the COVID-19 statistics from the 1st to the 11th of January 2022 shows that 81% of new infections is among the unvaccinated individuals. 2, 97% of admission to hospitals is of the unvaccinated individuals. 3, 94% of ICU admission is of the unvaccinated individuals. And finally, 91% of deaths is of the unvaccinated individuals. Statistics do not lie. Numbers do not lie. The benefits of vaccination are convincingly demonstrated even in Namibia. It is unethical and morally repugnant to deny a scientifically proven benefit to an individual without offering a viable alternative to the proven benefits. It has also unfortunately come to our attention that some unscrupulous individuals are obtaining vaccination cards fraudulently while not being vaccinated. This is a criminal offense which is punishable by law. We therefore caution the public to desist from such criminal activities. As the government is addressing the pandemic, efforts to ensure adequate preparedness are ongoing. This includes infrastructure enhancement in terms of isolation, as well as provision of adequate intensive care units, adequate oxygen supply, procurement of equipment, provision of sufficient mortuary facilities, and recruitment of additional health workers. The COVID-19 epidemiological trajectory helps us to make informed decisions when reviewing the current public health general regulations. We remain committed to strike a fine balance between public health and the imperative of safeguarding people's livelihoods and the revival of the economy as we adjust the public health measures. I will now proceed to unpack the amendments to the public health regulations. One, as has already been mentioned by His Excellency the President, the current dispensation will last from the 16th of January 2022 to the 15th of February 2022. However, if the situation deteriorates, which we do not anticipate for now, the measures may be reviewed at an earlier date. Gatherings. As the number of cases has plateaued, the number of attendees at public gatherings will remain unchanged at not more than 200 persons per event. I should emphasize here that if the venue where an event is taking place is small, the organizers must ensure the maintenance of the minimum physical distance and adjust the number of attendees accordingly. Public gatherings offer fertile ground for COVID-19 transmission. Curfew. Lockdown and curfew served as well in reducing transmission during the third and earlier waves. The current epidemiological environment does not warrant the reintroduction of a curfew. Education. The general health regulations related to education are retained without change. Educational institutions are allowed to operate at full capacity. Schools that are not equipped to operate at full capacity should make their own internal arrangements to adhere to the COVID-19 prevention protocol, such as rotational or alternative attendance of classes by learners. The Ministry of Health and Social Services and the Ministry of Education, Arts and Culture will continuously engage to find the best balance between adherence to prevention measures and the provision of quality education. Restrictions related to liquor remain unchanged. When it comes to business operations, the owners shall continue to operate in line with the provision of their business licenses. Business owners of restaurants, bars, cabanas, hair salons, and others, they must enforce compliance with COVID-19 protocols by their employees, such as the strict wearing of masks. It is also the duty of clients to demand the wearing of masks by waitresses, hairdressers, and other service providers. The wearing of masks by all in public space remains a mandatory requirement in Namibia. Contact sports. The total number of spectators at the sporting events should not exceed 200 persons, as is currently the case. In other words, the number of spectators at sport events should always remain aligned with the regulation on public gathering, where the limit is set at 200 persons per event. Public transport remains unchanged. On burials, in line with the evolving scientific evidence, the rituals related to burials of persons who succumbed to COVID-19 and those who died due to other causes will proceed in the same manner, but with due regard to infection control measures when a COVID-19 positive body is handled by healthcare workers and undertaker personnel. Physical contact with the remains of a person who had COVID-19 by a person not trained in infection prevention and control, such as members of the public or family members, is strictly prohibited. The standard operating procedure with regards to burials will be adjusted accordingly. Restrictions on the number of persons permitted at memorial services and burial sites should not exceed 200 persons as per the regulation, and all prevention protocols should be strictly enforced so that we do not revert back to the time when the burials of people who have succumbed to COVID-19 have to be strictly regulated in order to contain the spread of the virus. We observe with compassion that people are taking long to find closure after losing their loved one, especially those that succumbed to COVID-19 during the early days of the pandemic, when burials were only allowed in localities where the death occurred. I should emphasize here again that exhumation of the remains of those who passed on due to COVID-19 for the purpose of reburial at a preferred burial site is possible. All lawful procedures should be followed in case this is opted for. The first step is to approach a competent court to authorize the exhumation. Rapid antigen tests. There are several COVID-19 rapid antigen test products on the market. It is important to ensure that the products approved for use are validated by the Ministry of Health and Social Services. We have noted with concern that some service providers are inflating their prices. It is unethical to cash in on the misery of others. The measures related to the use of COVID-19 rapid test is retained without change. Requirement for entry in the country. This is very, very important. Fully vaccinated Namibians, permanent residents, and truck driver, I emphasize fully vaccinated Namibians, permanent residents, and truck drivers will no longer be required to present a negative PCR test results upon entry into Namibia. The above-mentioned categories of people can enter the country at any time with a valid and authentic vaccination card. For all other categories of travelers, including truck drivers who are not fully vaccinated, the validity of a negative PCR COVID-19 test results remains 72 hours from the time of the collection of the specimen to the time the individual presents himself or herself at the point of entry into Namibia. Non-Namibians who arrive with PCR test result older than 72 hours and are not in a position of de-isolation certificate will be denied entry in the country. Namibians who arrive without a valid PCR test result or de-isolation certificate will be subjected to a PCR test at own cost at the point of entry and will be quarantined at own costs. Such traveler will be released from quarantine if the PCR results are negative. Namibian citizens and permanent resident permit holders who present positive PCR test result at point of entry may be allowed to proceed to the final destination and be subjected to isolation at own cost or to a supervised home isolation, provided that they have obtained approvals of such supervised home isolation from the responsible official of the Ministry of Health and Social Services. During the 38th COVID-19 public health briefing, the Ministry proposed some measures to understand the extent of Omicron variant distribution in Namibia. This included random testing of travelers arriving in Namibia and further subjecting the positive sample to genome sequencing. It is now clear that Omicron variant is widely present in the community, and therefore random testing will not be implemented as it will not add any value to the pandemic response. The situation will, however, be closely monitored and this may be revisited if the need arises. As I approach the end of my statement, I would like to thank all my fellow ministers and their staff for working with the Ministry of Health and Social Services shoulder to shoulder in fighting the pandemic within a whole of government approach. Heartfelt appreciation to the private health sector, diplomatic community, the Namibian business sector, development partners, and civil society organizations for their swift and relentless support. Our elected, traditional, and religious faith-based leaders have been great catalysts in improving the uptake of the vaccines and ensuring adherence to public health measures. We thank them mostly and encourage them to continue to do so. I would also like to applaud the healthcare workers and other frontline workers for standing firm in the face of this invisible but deadly enemy. I'm humbled by your compassion, resilience, and bravery. To those healthcare workers who have kept the fire burning by providing continuous essential health and social services to our people, you are equally heroes and heroines who deliver in trying times with diminished resources due to the diversion of resources to fight the pandemic. We are invigorated by the leadership and guidance of His Excellency, the President, as he steers the nation into doing what is right and in the interest of our nation, and ultimately making a contribution to pandemic control in the world at large. Finally, I implore the vaccine skeptics to abandon their anti-vaccine campaign and to join the nation to successfully fight COVID-19 together. There is nothing for you to gain in undermining government efforts. I thank you.
Well, thank you very much, Honourable Minister. Are there other ministers, even top table too, who would like to add, especially take only already legal people? Oh, you are hiding behind that thing. Huh? Yeah.
So I would just wait for questions. Thank you.
Very good. Thank you. Any other? Yeah, it's straightforward. Who is that?
Good morning, Your Excellency, Deputy Minister of ICT.
Oh.
Thank you so much for the opportunity, Your Excellency. I just wanted to stress on one thing that we noticed, especially during the festive season around fake news and misinformation, that the public is reminded that the information received on social media platforms at many times is information not originating from our country or within our borders, and therefore it makes it very difficult for either the law to take its course or for the public to verify whether that information is authentic. And that is where we encourage citizens not to forward information that they have not double-checked or fact-checked, especially from trusted health sources such as the Ministry of Health and Social Services. And would like to remind the public that under the law that there is provision made for misinformation and disinformation not to be spread, and that it is up to the responsibility of citizens to guard against spreading information against COVID-19 and related matters such as the vaccine. Finally, Your Excellency, social media networking sites have become major conduits of online disinformation and misinformation, and we urge citizens to do a fact check on all information that does not emanate from trusted sources, because the responsibility now lies on them. Thank you so much, Your Excellency.
Thank you very much. Education. Don't you think you have to inform us as parents what's happening? That's a very important area. Before they ask, they are going to ask you that question anyway.
Thank you very much, Your Excellency, and compliments for the new year. Yes, on education, the most important information is to say, as it was said by the Minister of Health, that the schools are open, fully open, and all the learners are expected to go to schools. With regard to compliance and adherence, we as the ministry has dispatched money through the regional offices to the schools to purchase PPPEs in order for them to be able to adhere to the health protocols. And also, we have issued Circular 1 of 2022, which is guiding our schools on how to take care of the situation. The only thing that one really want to emphasize is the issue that the problem with compliance in schools is affected by the issue of the nature of children themselves. That's why we really want our parents and all the community members to work with us in order to educate our children also when they come from home. To be able to listen and adhere to the protocols, and our teachers also to be able to really guide these children. And I would be indebted if I wouldn't thank all our teachers, Your Excellency, for really having been resilient all these years. There are countries that totally shut down their education systems for 2 years. But we would be really indebted if you don't thank our teachers for their perseverance and ensuring that they follow the guidelines and they keep their education running up to today. And with those, Your Excellency, I believe I will be ready to ask specific questions if there are some.
Now, thank you very much, Ministers. Now the floor is open for short questions, because it's a very straightforward matter. Happy New Year.
Good morning, Your Excellency. Happy New Year to everyone. Compliments, yes. My name is Shaligan Peterson. I'm a journalist with the Namibian. My first few questions will be to Dr. Shangula. Can you explain why we see this lag between the cases going down and the hospitalizations and deaths increasing? Although in other countries we see it playing out differently, where they are going together up and down. And then what are your experts saying about COVID nearing its natural end? South African and UK health experts have said that when a virus becomes less vigorous, for instance, it signals that the pandemic is nearing its end. Do our experts think the same way or feel the same way about it? And last year we destroyed 150,000 vaccines. Will any more be destroyed? And I didn't hear you mention the vaccination rate. Can you just tell us that, please? And how far is government with its decision on mandatory vaccination? I see we have now sort of limited, or we have now given those who are fully vaccinated a privilege of coming into the country without PCR tests. And then Finance Minister, perhaps I haven't been well informed, but can you please tell us what is our recovery plan from the devastating impact of the pandemic? I know the green hydrogen will only sort of reap proper fruit in 4 years. What are we doing in the meantime? And Minister of Education, do we know how many learners dropped out of school last year, especially after the aggressive third wave of the COVID-19 pandemic, and the fact that a lot of parents and students lost families? We just want to see how that impact translated into the education system. Thank you very much.
Minister of Health.
Thank you very much. Thank you very much for your very good questions. The first question relates to, on one hand, we are saying that the number of new infections is decreasing. However, the number of hospitalization and death seems to be on the increase. We need to understand that it is not entirely correct to say that the number of hospitalization is increasing. What we are giving is cumulative numbers of everybody who is in the hospital. When you look into the daily report, we deliberately made 2 columns. What was the previous day, and what's the current, and what is the current number of hospitalization. You will find that in most instances, region by region, you'll find that in some regions, actually the number of hospitalizations are coming down, but in one region, the number of hospitalizations going up. So more or less, there is a sort of a balance between going up and going down. They even themselves out. So that is actually the position. The second question relates to whether COVID-19 is nearing its end. Now, when you have an infectious disease, the factors which determine the persistence of an infectious disease in a population is actually its basic reproductive ratio, which means that how many cases is arising from one case. Now, this is measured in terms of R. Now, if the R is more than 1, it will mean that there is a propagation of the infection. But if it is less than 1, which will mean that one case will no longer give rise to another case, then the infectious disease will eventually, die out. Now, from the side of the population, you must have a susceptible population. But if you have a population which is vaccinated, which is protected, then it will mean that there will be no susceptible individuals. Even if there is a circulation of the virus within the population, it will not find a host to attack. In that way, then eventually the infectious disease will die out. The third question is whether more vaccines will be destroyed. Now, we must understand that the vaccines, they have the expiry date. Most of the vaccines, they have a short lifespan of about 6 months. There has been challenges with the procurement of the vaccines. In the past, you may, as we have seen in the vaccines which expired, you receive the vaccine with a shelf life of 1 month, but then the uptake will not be accomplished within that 1 month. But you can no longer use the vaccines beyond 1 month. So that is actually what led to the situation where some of the vaccines were rendered not fit for use. We are trying to work with the suppliers that at least whatever vaccine we get should not have a shelf life less than 3 months. That way, we will be able to use up all the consignment which we receive. The other question is, what is the vaccination rate? As I have mentioned in my statement, actually there is a great improvement in the vaccination uptake, and this is an encouragement to us. And we also encourage the population to present themselves so that they can get vaccination. At the present moment, we are satisfied with the uptake that people are coming. We are not saying that it is enough, but we are saying what we have experienced in the past compared to what is happening now is a positive development. And the final question was, how far are you with the decision on mandatory vaccination? As has been announced by His Excellency at the beginning of the vaccination campaign, vaccination remains voluntary, and that's the policy up to the present moment. And we should live with what is at the present moment. If there is going to be any change in the policy, obviously that will be communicated to the public at an appropriate time. There were also some questions which I received. The other one was on mandatory vaccination, which I have addressed. The issue of the contact tracing. All our actions, they are informed by the epidemiological situation in the country. Now, when you have an outbreak, there are different stages. You go when you have a cluster situation and when you have a community situation. Now, in each respect, you devise the appropriate strategy which actually talk to the prevailing situation. And therefore, at the beginning, we really paid much emphasis on contact tracing in order to avoid community transmission. But we have a generalized community transmission, so some of the strategy we employed at the beginning, they are no more appropriate for the current situation. At the present moment, our main focus is on positive individuals rather than on contact. So those were the questions which I have obtained so far. Thank you, Comrade President.
Thank you. Minister of Finance.
Thank you, Comrade President, and Happy New Year, and to the media practitioners and fellow Namibians. With regard to the recovery, I believe what we are doing now is part of the recovery. When His Excellency is in charge of the measures to control the pandemic, it means that's a measure towards promoting the recovery of the economy, because if we have COVID, it means people's mobility will be constrained, productive capacity of the economy will be constrained, and therefore we will not be able to recover. So hence all these measures that are being put in place to contain the pandemic, it's part and parcel of the recovery plan. Secondly, our recovery plan, as I have said in the budget statement, is HPP2. If you go to HPP2, goal pillar number 2 and goal number 3, I believe, is talking about finding new engines of growth for the economy. You have pointed out green hydrogen. That's one of the new areas of growth that Namibia is trying to pursue to not only contribute to the recovery, but also contribute to the diversification of what we are already producing. Because what we have learned is that countries that have successfully diversified and grown to a significant extent are those that have targeted new areas of growth. And we believe green hydrogen will be the new energy of the future. And if you play in that space, definitely you are going to reap benefits from there. Thirdly, under HPP2, we were tasked by His Excellency to develop what is called a diversification strategy, which was launched last year as well. And we have announced that under this diversification strategy, we have so far identified 97 products where Namibia can venture into. So the strategy now is to work with both domestic investors and foreign direct investors to say, these are the areas where we believe Namibia has got potential. For the domestic investors, there are already those who are operating in some of those sectors, but we believe there's potential to scale up those activities. How do you do that? There's a need for coordination between the private sector and government. We have now started piloting in December already 2021 with what is called a productivity task force, which is basically a dialogue between the private sector that is operating in that particular sector. In this particular instance, we have started with what is called higher value fruit products, things like grapes, blueberries. We had a very productive discussion, which was the first of this kind with those investors. This will continue to go on for about 3 months or so for us to gain some skills, and then we'll roll it up to the rest of the other industries. So these productivity task forces are basically going to help us to coordinate things better between the private sector and governments for us as a country to work together and move into these new areas of production, export diversification, and of course growth and employment creation. I think this is, in essence, really, apart from many other things that we need to do to improve access to social services and other things, because all these are part and parcel of the well-being of the nation. But in terms of economic growth, this is in summary what we are doing. Thank you very much, Madam President.
Well done.
Thank you, Your Excellency. I would like to answer the question on the number of dropouts. I would confidently say, qualitatively, we didn't lose many children dropping out due to COVID-19 aspects other than other variables that we are still analyzing. Compared to the year 2019, 2022, where we used to close schools. Due to the fact that we kept our children in schools, we don't expect that much of dropouts. And for the information of the inquirer, we are still busy with the analysis of our education census information, as informed also by the 15-day school day statistics. And it's always good for our stakeholders to also approach our ministry through the Education Management Information System Department to get quantitative information concerning the specific aspect. But otherwise, we did not lose children dropping out due to COVID-19 as compared to the previous years because of the continuity of learning that was taking place. I thank you.
Okay, next round. Oh, ladies first.
Good morning, Your Excellency. Good morning, all, and compliments for the new year. I'm Linia Dishena from Namibia Press Agency. My question is to the Minister of Justice. We have seen that some companies have started to make the vaccination mandatory. For example, like Letsaho already gave its employees until January the 31st for them to get vaccinated. I just wanted to find out from the legal side, how lawful is this, especially knowing that from government is still a choice.
Thank you. Yes, Minister.
Your Excellency, I think the question of mandatory vaccinations is relatively complex, and the position of government should be the guiding light. In other words, at the moment, vaccinations are considered to be voluntary. That's the first point. Secondly, what we've indicated, and actually this is the purview of the Ministry of Labor and Employment Creation, what members of staff at any institution where the vaccinations are made mandatory should do, Your Excellency, is to actually approach the ministry and inquire what steps should be taken, because ordinarily the Labour Act has provisions in the Act that makes provision for health, safety measures and those kinds of things. And what I expect should happen is if members of staff or employees are unhappy about the conduct of the employer, they should approach the Ministry of Labour and Employment Creation to investigate the circumstances and also provide guidance that needs to be provided to that particular institution. Thank you.
Just to ask, when you came here, were you required to show your vaccination passport? When you were entering here, what did they do to you? Do you show something? They don't do that. You just walk in. That's a problem. the guys. You should start from here, from offices, that officers must not allow people who are not vaccinated to come into their offices, like here at State House. Are you vaccinated? But nobody asked for that when you came in here. That's a problem. In Europe, what they do is even in supermarkets, when you're coming in, they ask for the vaccine mandate. So we must, without forcing people to use that kind of tactics, that the workplace, the ministries, the private sector also must require their people to have the mandate to enter the premise before we can force people. Because in democracy, forcing, there are going to be court cases, you see. Yes, sir.
Morning, everyone. Morning, Mr. President. Morning, House Minister, Deputy, and so on. Compliments for the new year. I'm Dwight from Eagle FM. Health Minister, you already answered my questions. Yes, you already answered them. Mr. President, just one for you. Is there a policy, is there a mandate in the presidency's office that all staff members should be vaccinated? It's just to provide that clarity also for the nation. Second on to that is Justice Minister, just the same question, but now just on the rights of individuals versus the rights of companies to operate. Where does the line end? Although we know government's clear stance is voluntary vaccination, but clearly the rights discussion keeps being thrown around by individuals in public. Lastly, Education Minister, is there a trend? Because last year we had the same sort of spike in the schools, starting at the beginning of an educational year. Last year, we're seeing the same thing in terms of the COVID-19 reports daily. Is there a bit of a concern, or is it just still taking precaution, advising the schools heading into the new educational year? That's all.
Well, mine first. State House was hard hit. This is starting from the top, all of us. And there are also serious cases of security people and so on. So therefore, mandatory showing of the passport is very important. Problem of Namibians is that we like to cry foul. Something in your own interest. Your life. Somebody must teach you, beg you. I'm being teased by people. I said, I'm not going to beg you. They said, please. Why must I go through that? For your own safety, safety of the nation, our lives. Why must we beg each other? Why must we play games with the lives of people? Why must I chase you around like a child? And people are dying. It's not a propaganda, it's not a lie we're telling. We're burying people. Now why must we go and beg you? You're a grown-up person. It's not a rumor. The facts are there in our faces. People are dying. We are burying our people, loved ones. Now what more do you want to have as a proof? To be convinced? Law to be passed, so we can say, oh, we are being forced, our rights, and so on. We are saying let's do it. It's in common good for the country and for the world. That we comply with the rules, get vaccinated. It's the first line of defense. What is the problem about that, really? Is it complicated? What are we looking for? Why must we be forced? Why must we have a mandate when the thing is affecting you, your family, your loved ones are dying? They have died. We buried people. It's not a joke. So please, once more, don't force government. Maybe it's to say dictatorship, we are being forced and so on. It's in your own interest, country's interest, your family's interest, to be vaccinated. Yes?
Your Excellency, I want to just make 2 points. The first one is, I think it is common cause that there are competing interests. It's the right of the individual to bodily integrity and to decide how they want to conduct themselves and how they want to interact in the society in which they live. There is also a governmental responsibility to protect public health. When there is a public health emergency, that's actually a higher, almost a higher interest to protect, because it's for the benefit and it's for public good. So that's the one thing. There's also a fact in law, and particularly where you have a supreme constitution and a constitutional democracy, that you have limitation of rights. Now, what we are not saying up to this point as government is we have not forced anyone to be vaccinated. But what it does, though, and it's quite interesting because I think the members of the public are also quite disingenuous about how they react to government's intention to protect the public good and to do something for Namibians. And when people want to travel, they actually comply with those requirements elsewhere, and particularly in other jurisdictions. And I think people really need to make a decision about how they want to interact in this particular society of ours. At the moment, we do think that the first line of defense against this is the other public health measures, such as the correct wearing of masks, and where it's possible, maintenance of social distancing and sanitizing. But I think there is that additional line of defense, which is vaccination. The Minister of Health has now, in today's statement I saw, that he had actually indicated the effectiveness of the vaccines that we have in the country. One of the requirements of the World Health Organization is that you must have available vaccines. So vaccines must be available, and the level of effectiveness must be known to the public. Also, the public must be notified and informed about the consequences of the vaccines that they take, and also in what circumstances they don't have to take those vaccines. There hasn't been a blanket application of the vaccine mandate. What has been available is that people still have a choice, but I think that choice is limited by the choice and rights of others. And I think Namibians really need to make a decision for themselves. I do hope, though, Your Excellency, that at some point we will have an opportunity that the courts would have made a decision about these competing interests and rights that we have. Thank you.
Thank you, Your Excellency. On the question on the concern, I thank you that you answered that question. It shouldn't be construed that when we are saying school are open to full capacity is because there is no concern. The concern is ever there until such time that the health sector will be able to tell us that now the COVID is completely gone. But it's a matter of striking a balance between the consequence of having your children closed up in the communities and bringing them to a school where you feel that you will have to embark upon strict regulations and adherence, education to the children, while at the same time, education of the children are continuing. I hope we have listened to the news recently, where the Ugandan government is only opening this year after 2 years. There were complaints about thousands, tens of hundreds of thousands of children who could not be traced again to come back to school. And also us, when we closed last 2020, we had clear statistical information of the children that we couldn't trace to come back to schools. We had clear statistics of girls, children who got pregnant. So it should not be construed, neither should it be mistaken that we are calling children back to school because it's now safe. That's why we open our schools with clear guidelines on adherence, on how to protect our children and teachers and all the staff at schools. But otherwise, it's a matter of balancing, honestly. Where are they safer? Where can we be in control? Where are they more exposed to other, social ills than being at school? And so far, we really believe we have done well as a country to keep our children at school. I thank you.
Any other, or are we ending here? I would like to thank you, but before that, I'm imposing on the Vice President, who went to represent us somewhere, to just give us it's in public interest, just to give us a rundown on what happened in Malawi, why you went there.
Thank you very much, Your Excellency, Comrade President, Honorable Deputy Prime Minister, Minister of Health and other ministers, our colleagues from the media, good morning. Yeah, well, the President was giving me some signals. I thought I will comment on the issue of COVID, but that one is now aside. I was delegated by His Excellency the President to represent him in 2 meetings at the same place. First, the extraordinary meeting of the organ of SADC, which is called a Troika, where South Africa is the chair, Namibia is the incoming chair, and Botswana is the outgoing chair. Other people also were invited for specific reasons because of the issue we're discussing, Mozambique issue mainly. It was the key topic. And then yesterday, Deputy Prime Minister was also together with us, so is the Minister of Finance. We had the extraordinary meeting of SADC as a whole. The first meeting was chaired by President Ramaphosa from South Africa, and the second meeting was chaired by President Chakwera of Malawi. And what we are dealing with is really the issue of the attack by people we have to consider as terrorists in the northern province of Cabo Delgado. SADC has principled policies that say an attack on one of our members is an attack on all of us. If we have other people coming from other countries attacking us, and we say, oh, that is only for Kunene, or that is only for Karas, or that is only for Gobabis and not for Swakopmund, you can't maintain peace. Without peace, there is no development. That was the main topic. Other countries has committed resources, even personnel, and we are coordinating on that. And yesterday I was asked, as we were leaving, Comrade President, as we were leaving Kamuzu Airport in Malawi, whether we have committed troops. That is what they are interested in. And we are saying there are many other ways of assisting and supporting Malawi, Mozambique. We have not committed the troops, but we are part of SADC. And we will continue to support the policy of SADC and initiate other measures on ourselves to help Mozambique. There are appeals for food, there are appeals for other items, there are appeals for future in terms of police and correctional services, but those are things to be discussed in the future. But for now, we have extended the mandate of the soldiers from SADC countries who are in Mozambique supporting the Mozambican Defense Force. And the president who were there, the president of Mozambique, President Nyusi, was appreciative of the effort by other SADC countries to help them and basically to help one another. Comrade President, with your permission, now just to say a few things on, not on just on the topic we have been discussing, to wish especially our learners and students, teachers and other educators, all the best in the new year. It has been a very terrible year last year. Online learning, what this, what that. Now schools are open. And in this process, we do truly have to support our medical authority. How can you be a teacher standing in front of a classroom every day, preaching at the top of your lungs, and you are not vaccinated? And in the future, your student will get sick. COVID is a terrible disease, attack everybody, irrespective of color, gender, religion, politics, whatever. So we should take it seriously. The issue of mandatory vaccination. Will you really want to be forced to protect your own health, as the President has already said? What would you think if somebody has diabetes and refuse to accept insulin? Hypertension, refuse to take the medicine. Coughs, refuse to take cough syrup. Cancer does not want to be treated the way all cancer patients are treated. We let us love ourselves in order to love our neighbors. Once again, Happy New Year, Namibia, and let us do the right thing. Let us get vaccinated. Thank you very much.
On that note, thank you very much. Good luck.